Hello, my name is Gabby, and this is my video statement of intent for the FIU 2025 fall semester application for the counseling psychology program. I currently work at a private mental health center in Coral Gables called South Florida Integrative Medicine, and I recently acquired my bachelor's in psychology from FIU. My goal is to become a licensed mental health counselor, and I intend on doing so by learning of the various counseling theories and techniques. I also intend on deepening my understanding on the various mental health disorders, their criteria, and their specific treatment modalities. Another one of my educational goals is to become familiar with the ethical guidelines in counseling in case I do have a legal issue that may arise during my experience as a therapist. After graduation, I do intend on becoming a licensed mental health counselor, like I said before, and I do want to work with many different populations, including individuals, families, couples. I also want to do premarital counseling. I want to do group therapy, and I also intend on working with underprivileged kids that don't have a lot of access to mental health care and that come from broken homes that have parents with mental health disorders. Some of my specializations are to be in anxiety, depression, ADHD, OCD, personality disorders, mood disorders, trauma, grief, and like I said before, couples and family counseling. I also want to work heavily in the queer community. Studies show that 25% of queer individuals are hesitant to localize a therapist because of fear of being outed to their families or just not finding a good match for their experience. Some of my career goals are knowing of referral sources in the community. Sometimes you won't be able to provide specific sources to your clients or specific resources to your client, and that's totally okay. Sometimes your client might need a higher level of care. This might include medication management, inpatient facilities, substance abuse facilities, or even sometimes, unfortunately, hospitalization. My last career goal is to write a book on breaking Hispanic generational trauma. I myself grew up with Hispanic generational trauma. I suffered from a lot of abuse growing up. Both of my parents, unfortunately, they do have mental health disorders and substance abuse disorders. So I would like to advocate for people that have had similar experiences to me. I know that a lot of the younger generations are more accepting to therapy now, and they are willing to heal from their childhood. I want to break the Latino stigma that therapy equals weakness. The program meets my goals. It helps me meet my goals because it is accredited by the American Psychological Association. It is known for preparing its students for the licensed mental health counselor exam. It has meticulous training. It provides extensive clinical experience, and it has an emphasis on cultural competency, opportunities to network, and it is a very hands-on program, which is important to my personal experience. Some of the qualities that I think I have personally is that I am very hardworking. I am empathetic and compassionate, which comes back to my own personal struggles and my own trauma. I think I'm able to resonate with a lot of people, and in turn, this makes me want to help them and lend a helping hand. I also like to make people feel confident, and I like to advocate for independence and autonomy. I also like to help people feel like the best version of themselves. And I am also a very creative person. I'm very crafty. I think that this will help my clients, especially the ones that have issues verbalizing their emotions or expressing themselves. Sometimes art is an amazing form of therapy. I'm also very patient and calm. I'm a good leader, and I love to learn. Like I said before, I do work at a mental health center. It's called South Florida Integrative Medicine in Coral Gables. I have been working there for almost 3 years. I make 3 years in April. I'm very happy there, and I have learned a lot about the fields of mental health. I did work at a previous mental health center in Little Havana. It was called Coral Community Mental Health, and it is a community mental health center. I have seen the two drastic opposites of these two corporations. I've seen how disorders like schizophrenia or other disorders that may require a higher level of care might impact people's lives. And then you also see the more mild disorders such as anxiety or depression might impact people. I also see the day-to-day lives of therapists. I see what they go through, how they interact with their clients. I think that this has really motivated me to continue my journey as a therapist. And I'm also able to participate in exposure therapies. One of my therapist coworkers, Gabrielle, she always includes us in exposure therapies for her clients that have social anxiety. And this has made me also really motivated to use exposures in my own therapy in the future. I also am able to see what questionnaires are used, such as the GAD and PHQ-9 and other types of rating skills. I think that this is a really important function to have as a future therapist, and another important tool to have as a future therapist. So this concludes my video. Thank you so much, and I hope you enjoy it, and I look forward to hearing from you soon.